Are you looking for your career in US healthcare? Are you interested to work in a domain which is a domain of or industry of the future, and you are looking towards working in this area while staying in India? Then today's episode is for you. Hi, my name is Dr. Nitin, and I help uh, professionals, particularly healthcare graduates, medical graduates, to perform and grow in the healthcare industry. So if you are new to this channel, please subscribe to this channel, and you can stay updated with me on various tips, tutorial ideas, and strategy to grow your career in the healthcare industry. So to discuss on this topic today, we have a very special guest who is currently working in US healthcare industry, and we'll be talking about it in more detail very shortly. Today's guest, he is a very gentle person. He's a very gentleman, and he is always a helpful person. And he is going to help us today. He's a very down-to-earth person who is going to help us today and give us clarity about the careers in US healthcare industry. So, without further delay, I welcome you, Dr. Swapnil. Today we have guest Dr. Swapnil Erande. Hi, Swapnil.
Hello.
Yeah. Dr. Swapnil, can you tell us, our audience, something about yourself so that they get to know about you?
Sure. Thanks, Dr. Nathan. Hello everyone. I'm Dr. Swapnil. I'm a doctor. I'm working in the US healthcare industry for more than 10 years now. So after graduation, I was into clinical practice, and there was a certain turn in my career where I chose US healthcare as my career option. So yeah, so it has been like more than 10 years, and I'm happy with what I am doing currently.
Okay. Thank you, Dr. Swapnil. Thank you for your introduction. Dr. Swapnil, today we'll be talking about this US healthcare industry. How is the career opportunity and career scope for the any graduates who are particularly from medical background, or who are trying to enter into this industry. To begin with, just briefly, can you tell us, uh, particularly for the audience, those who don't know about this US healthcare industry? For last 2 minutes, we have been talking about US healthcare industry. So there might be some confusions about this term. So would you like to clarify what is this US healthcare industry?
Yes. So the US healthcare industry is very vast. So as you know, US is already a developed country. So can you imagine the number of like the amount which US spends into the healthcare? It is like above 1.5 trillion dollars per year. So it is almost equivalent to India's GDP. So just imagine how much US is focusing on healthcare. So basically, the US healthcare industry flourished when Obama uh, took over as a president. So there was a healthcare program where it was named as Obama Healthcare. So earlier they used to follow the same routine which we as Indians used to follow in healthcare. They used to have everything documented on papers. But slowly and gradually, they started converting those handwritten documents into technical, or if we can say, into applications. So everything was digital. So currently, everything is digital now. Uh, so after 2010, this industry did flourish a lot. So just imagine if US is spending 1.5 trillion dollars per year on an average for healthcare. They're outsourcing more than 75% of the work outside to the other countries. So India was the topmost country. Now Philippines is into competition for this US healthcare related outsourcing. Then even I had heard that Pakistan, there are a few other countries like Nepal also into US healthcare now. So yeah, this industry is very vast, and almost like 92% of the US population is insured now. So everything, each and everything goes into insurance. 92% of the population related healthcare data goes into through insurance. People do get an advantage who are US citizens. So yes, though like US uh, is also focusing more on the military and other stuff, but yes, it is more focused on the healthcare part for their citizens.
So, Dr. Swapnil, as I understand, when we talk about US healthcare industry, so definitely it is consisting of the clinical and the non-clinical aspects. Within when we are even talking about the non-clinical aspects, that also contains different aspects related to healthcare industry, right from insurance and technology and documentation and various other aspects. So even if we look at the growing size of this industry and the kind of impact that is making across the US. So looking at that volume also, even if we talk about the outsource part to countries like India, Philippines, Pakistan, and any other Southeast Asian countries, I'm sure this must be a very huge number and huge industry within itself. So when we say about this particular aspect or this outsource services or outsource businesses within the healthcare in India, so can you tell the audience about what are the different kind of job opportunities that are particularly available in India when we are talking about US healthcare?
Yes. So we'll talk on the basics like whenever a healthcare professional is getting graduated. So that particular person looks after clinical practice. So let's say this healthcare professional includes anyone like MBBS graduate, BAMS, BHMS, BUMS, or any physiotherapy graduate, or let's say a dentist, or even a nursing professional. So they do prefer clinical practice first. But can you imagine like there are almost like 80,000 MBBS doctors getting passed out every year. And if you take all the healthcare professional as a whole in India, so every year there are like more than 5 lakh graduates which are who are getting passed. So just imagine now currently the data says like after every 700 people there is one healthcare professional. But with regards to this type of rate, like more than 5 lakh healthcare professionals getting graduated every year, so this ratio might get to a downsize, and then there will be an actual struggle of career opportunities and all. And as we all are aware, like not everyone get that success being a doctor or any healthcare professional in Indian healthcare industry. So some of the healthcare professional do compromise on their salary packages. So this is something which is different. Like everyone is not aware regarding this industry where we call it as a US healthcare industry. So if we are only focusing on US healthcare industry, so this industry is very vast. So in India, only 50% of the population is insured, but in US it is like more than 90% of the population. Those are insured. So those health records are into digital format, and this health records are entered into EHR or EMR. So EHR means like electronic health record. So these are certain type of applications where the data is stored, and this can be visualized from any corner of the world. So it do have certain view only access to patients and doctors. So we'll not go into detail for these applications, but this data is into AHR and EMR. So whenever you're starting your career in US healthcare industry, just try to focus like where you want to make your career. So there are two types of uh, path which you can focus on. One is the payer side, where we payer means insurance companies in US. So they do outsource their data to the any Indian company, or they do have their branches in India, and we work for them. So this is payer based. Second one is the provider base. So we work for doctors who are there in US. So we have few companies who are provider centric companies, so, and many more. So as we all are aware, like we have TCS, Infosys, Cognizant. So these are giants mainly in India, but no one is aware like they do have a connection with US healthcare as well. They do undertook take processes or projects which are outsourced in India. So multiple things, but people are not aware. So these are the things. So whenever as a healthcare professional, if you're starting your career in US healthcare industry, so just the basic thing is just make sure you have a good contact with other folks, like let's say your seniors, or you should have your CVs regularly updated through various platforms, Naukri or Indeed, anything. You should have an account in LinkedIn. This is my suggestion, because LinkedIn is a platform where you can have professionals from all the sectors, and you can have a good connect. You never know, like any opportunity can be shared through that platform, and if you are there at the right time, then you can grab it. So, and if we are talking about US healthcare opportunities, so there are multiple things. So, first thing is like I can say is you can start working as a provider assistant. So, whenever in US healthcare we say provider, it is always a doctor. So they do outsource their work to India, where you act as an assistant to them, and whatever work they are assigning, you have to complete it. So there are few people who do a role as a consultant, or do any sort of part-time job where you take that project and complete it, and you are paid uh, accordingly. So these are the things. Then you can start your career for claims analysis. So there are few industries who do offer a training. So once they hire you, they will offer you a training for a certain period, and they will teach you how to do a claims analysis. And accordingly, you will be trained, and then you will start working on those type of claims analysis. Then there are few things. So as a fresher, I will recommend, like there are multiple things which do not require a training as such, because you as a doctor is well versed with what they are doing. So the basic industry is medical transcription, where the doctors in US, they do record their patient and physician conversation, and they will send that particular audio tape to you, and then you will start just typing whatever they are conversing. And the second type is medical scribing, where a doctor and a patient is actually doing a consultation. So it is very general, but you as a doctor needs to interpret like what is the medical part which you need to capture, and then you have to enter that particular data into that EHR, that is electronic health record format, and then you have to extract a chart note, which we call it as a summary of physician and patient conversation. So these are the things. Then we have medical reviewer job posts as well. Then medical summarization. So where you will be getting a certain data, and you need to summarize or review that particular data, and do a certain uh, what you can say SOP sort, which you can jot it down in a particular format. The workflow is already set. So there are multiple industries who works on it. and let's say even a data abstraction. So initially, the data abstraction part for US healthcare was huge, but now they had got streamlined. So the work is not that much, but still there are few scenarios where we get patient-related data in scanned format, where a handwritten report or a printed report is scanned and send it to you, and then you have to just take down the important aspects of that report and um note it down into that particular EHR or EMR. So these are the things. So apart from that, we have research. So research is a huge field, if like everyone is aware. So everyone is aware regarding the clinical research part. So most of the folks goes into clinical research certification after their graduation, and then they choose a field, especially the pharma industries. Um I can't say like this is a US healthcare part, but US healthcare do have a research part also. There are few industries who takes projects from um, let's say federal government from USA or any other private company, healthcare company from US, and they will do a research of their data. Let's say it can be a patient's data, or it can be any clinical trial related data, and they will do a research and give their reviews accordingly. So whenever a company in India is trying to outsource, trying to convince, or trying to take a project from US industry, so they do showcase that. So they will showcase their profile that they have so and so many doctors, so and so many healthcare professionals working from them, and then they will fetch that contract. So it is not like they will get a contract and then they will start hiring people. So it is always the first case. So yes, the industry is very huge, and you can't imagine like uh, the amount of money which can be procured from this industry is very huge. So just imagine it is like equivalent to a GDP of India. So it is that huge. There are there are few cases where, like my friends who after graduating had done MBA. So they had done MBA from the huge, bigger ones like IIM. Uh, so whenever you're doing an MBA, just make sure that you are doing an MBA from the bigger industries, bigger organizations like IIMs or any other organization, because the packages or the placements which these organizations will offer can't be offered by the smaller ones. So if you are trying hard, or if you're aiming to have something huge, just focus on the bigger organizations or the institutes. Then now, like as everyone is aware that AI is into picture now. Even the data related part is into picture now. So we as a doctor are also involved into data analytics, or what we can say is business analytics. There are few courses offered in IIM and all related to AI or data scientists. So you can prefer those courses as well. So once you are like, it is not about getting a certification. It is like if you're getting a certification, you should be thorough with whatever you had learned, and it is all about experience. So nothing comes freely or easily. So just make sure whatever you're earning, it is not about certification. It is also about the experience which you are gained through that particular institute. Then we have project management opportunities or product management. So let me give you an example. Like we have Infosys. So people are not aware that Infosys is into healthcare, and that too also into US healthcare, where they are developing their own product and they are offering it to the client and all. So, the client is having. multiple requirements. So this type of projects goes for years and years. So they had divided such projects into batches. So there are few folks who are working on those projects for like more than 5 years now. The people who I am knowing. So this is something which not everyone is aware about. But yeah, so these are the things which do happen, and this industry is very huge. We do have onshore opportunities as well. So this is something which we had heard only about engineering folks, like the software guys, when they say that we are going onshore. They had settled in US or some other countries. The same thing happens for US healthcare-based industry also. You do have a career opportunity where if you're performing well or if you're getting a job opportunity in US, you can go over there. So these are the onshore opportunities, and you are aware like the pay scale is very high if you're moving onshore. So yes, this is something which everyone should be aware and try to focus from the base itself. Like once you're graduated, just focus on what you want to achieve. Like if you're choosing a certain certification or a certain career path, then make sure that you're following that particular career path till the end. Then only you will be benefited. There are most of the people like who do start their career clinically with the clinical domain, and then they switch to the US healthcare domain, and then they will think that okay, I'm getting an opportunity into Indian insurance, then I will go to the Indian insurance. So they're indirectly spoiling their resume or the CV, which is not good as per me. So if you're choosing something, just stay on it, and surely you will be benefited. This is something like initially when the IT boom happened in 2000, so everyone used to be like, "What is it?" Like no one was aware regarding the IT. But after this so many years, this has flourished a lot. So there are people who had made their careers engineers and all. The same thing goes with the US healthcare also. So this industry is also flourishing now. So this has already started flourishing after 2010. So now there are opportunities. There are few doctors, for example, there I know few people who are doctors, but they are more into technicality. Like they're more interested into SQL or creating a code or knowing something which is technical. So yes, we do have opportunities for those folks as well, where we have Tech Mahindra. If you are aware, like we have Tech Mahindra, which is a company. Allscripts is a company. Infosys, TCS, they do offer such roles where you are into actual product making, and they do develop softwares and all, and you can give your thought, and even you can get involved into that product development. We have Deloitte, which is a like monster in this case, where they do offer jobs as well for such candidates. So yes, so such type of opportunities. Even I was not aware when I joined in this corporate world for this US healthcare industry. But now, if you will ask me, like this is like a sea, and you can take an advantage if you are aware like what you want to do. Just make sure that you should have some aim, you should have a focus, and then only I think you will be more successful.
Thank you, Dr. Swapnil. Surely this is a very huge industry, and to cover different type of role is not possible to cover in this only single video. So, so as you mentioned, like a few years back, there was a boom related to engineering and IT industry, particularly in USA. So, similar trend has been started in this US healthcare industry also. So I'm sure many of the medicos or healthcare professionals from India, they are interested to work in US healthcare. And as you mentioned, it's a huge industry. So when we say it is a huge industry, is there any equal demand for all the different kind of pathies in Indian healthcare? Like, is it only attracting MBBS doctors or any other medical graduates? They also have opportunities in US healthcare. What are your thoughts on this?
Yes, so even I used to think that only MBBS are preferred for such roles, but no, the case is something different. Even BAMS graduates or BHMS graduates or the physiotherapy graduates also are working equally. Then even there are few processes related to coding validation or claims analysis, which do hire nursing professionals. So the basic aim is that particular person who is getting hired or the candidate should be aware regarding the healthcare part. There are few terminologies or some other basic things related to healthcare, which a non-medico can't correlate and work for it. So these are the professionals who are preferred. I agree that the pay scale may vary. So if you're an MBBS graduate, then the pay scale will be relatively more. But if you are from some other pathy, or let's say you are a dentist or a physiotherapy graduate, still your pay scale won't be that much. But so in the initial phase, it will be low comparatively. But as the years will go on, you will gain more experience and all. So it is never about your certification, your graduation, like which bachelor's degree you hold. It is always about your experience. The experience is the thing which will count, and yes, so you'll be benefited more.
Yes, Dr. Swapnil, I completely agree with you. Just education qualification may not help you in a long run. Yes, definitely it's a booster at the initial stage, but I also agree that in a longer run, your skills and your expertise will definitely matter. So when we say about this US healthcare industry, there is such a huge demand. Definitely it's a very competitive industry, and uh, when it becomes more competitive, the industry will definitely demand something extra from you. So is your educational qualification, like your graduation degree, BBS, BDS, BMS, BHMS, or any other graduation degree, is that sufficient enough for this industry, or do you need something extra, some extra educational qualification, or any kind of certifications are required to work in this kind of industry?
Okay, so we'll go step by step. So if you're getting graduated now, so if you're going into MBA, so that is something different. So if you're choosing MBA as a master's degree of yours, then your career pathing is something different. So it depends on from what institute you're doing and all, and which actual subject you're choosing for MBA. And it also depends on your prior experience also. Like there are few scenarios where whenever there is a placement offered, so those companies will always see your experience first. There are few scenarios where you join MBA as a fresher. You don't have an experience earlier. So there are folks who do acquire 2 or 3 years experience or 5 years experience into some other industry, and then they will go for MBA. So this helps them because if you're owning a company or me owning a company, I will always prefer a candidate who has more experience as compared to a fresher, because it takes me time to train a candidate who is a fresher. But if the candidate is a experienced one, then my efforts or my money into training will be very less. So yes, companies do prefer experienced candidates. So this was regarding MBA. Let's say there are few industries who do hiring of a fresher candidate, and they will offer a training in their organization. So there are few organization who offer a training of medical coding once the candidate is hired. So there is a certain period of 2 to 3 months where they will offer a training of medical coding or basic US healthcare related training. Even their applications related training, which they have it internally. And so after so many months of training, then they will have a OJT, which we call it as a on-job training, where you will be having a mentor. The experienced person will be watching what quality of work you're doing and all. And then you will be you will be starting with your own work. And if I'm talking about training, so don't think that you're not getting paid if you're getting trained. Uh, the industry will pay you the actual salary which they had offered. But whenever we say a training, and if a company is investing in you in a training, so just make sure there will be something, let's say a bond, or they will have it in written format where if you're leaving this organization before a certain duration, then you have to pay them back because they had invested so much on your training and all. So these are the things. But yes, if you will ask me, like 90% of the crowd in US healthcare had started. Okay, so once you are into that particular process and the organization gives you training, then they will make sure that you are into an OJT, that is on-job training for a certain period, and then they will judge you accordingly as per your quality, and you will be given a mentor or a QA, and your work parameters will finally be evaluated. And then after that certain duration, then you will start the actual work. So this is something related to the actual job process. So like more than 90% of the industries do follow this process because we don't have this into our academics. So nothing is taught related to medical coding or any technicality or any how to do a claims analysis or something. So even the organization is aware, so they will make sure that you as a doctor is well versed with your basic knowledge, and then they will hire you. There are most of the industries do have an aptitude test as well during the interview process. So it is equivalent to like a MBA entrance, which you can say. So they will make sure that like you also have those skills in you to tackle any tricky situation. Uh, they will also take a personality test of yours, but most of them won't judge you, even though you are introvert or extrovert. So this is something which is a part of their hiring process. But still, yeah, most of the industries do have this personality test as well. So coming back to the certification part, I missed on one certification, that was medical coding related certification. So whenever you're getting graduated, so if you're into clinical stuff and you want to switch your career into this US healthcare industry, just keep in mind like anything or everything in US healthcare is all related to medical coding. I'm not talking about a code related to a software application or something which the engineers do use. This is like whenever you're talking about an application, so everything is digitalized, everything comes into an application. So the application won't see like what spelling you're writing. Let's say you're diagnosed with an appendicitis. So the application is not going to say, okay, fine, you have an appendicitis. So It is not like that. Everything is coded.
Can-
So
We
I
can
will
say like alphanumeric codes or some kind of
correct. Correct.
indexing they use to
Yes,
identify the
yes,
procedures, to identify the diagnosis, so that
correct,
computer can understand it.
correct, correct. So there are certain fields into those applications which will understand only the coding language. And this coding is universally recognized. So if I'm talking about US healthcare, then there are two bodies uh, which do offer coding certifications. One is AHIMA, and the second one is AAPC. So just make sure, like, if you have an interest in US healthcare, if you're going with this certification of medical coding, then it will be an add-on. Like, it will be helpful for you and for your career as well. Because let's say if five people are coming for interview and you are the only person who is having a coding certification, then the company will always prioritize you because you have something additional or special. Uh, I will give you some gist regarding this coding. So, coding is divided into two part, medical coding. One is a diagnosis related coding, which we call it as an ICD. So, everyone, like most of the people, will be aware that ICD coding and all. So these codes are diagnosis based only. So these are not not having a dollar value, not dollar driven. So this is just for information purpose. So if I am saying hypertension, so it will start with I series. So it will be alphanumeric. So this was related to diagnosis coding, and then we have procedures related coding. This procedures coding do so all these codes are having dollar value set for those codes, and there are like we have inpatient coding as a separate entity, and we have an outpatient coding totally different. This inpatient coding is something like whenever patient is admitted, then we prefer inpatient coding. And when a patient is coming to an OPD or an EHR or any outpatient facility, then this codes are preferred. So this codes, if I'm talking about this outpatient codes and all, so those are alphanumeric as well. So those are divided into multiple categories. So I won't go into details, but yes, if you are having a coding certification, medical coding, then yes, that will be an add-on for you.
Okay. So, Dr. Swapnil, as you mentioned, like if somebody enters into this industry with relevant uh, certifications and some kind of training, but looking at the growing number of candidates in this field, it's really a competitive field. And whenever there is a competition, you have to outstand and outperform from the rest of the others. And for that, definitely you need to showcase some certain kind of skill level, certain kind of expertise. So, let's say somebody wants to grow and really succeed in US healthcare industry. Can you elaborate more on the what kind of hard or technical skills are required, and maybe what kind of soft skills would be helpful for the candidates?
Basically, you should have a good communication skills. So it should always start from that. Like, just focus on your communication part because many a times you need to have a conversation with the client or the doctors who are there in US. And even though you are intelligent enough, you're good at your work, but you're not able to portray what you are showcasing, then it becomes very difficult. Um, so just focus mainly on your communication skills first. Then there are a few basic things. Let's say your email etiquettes, like how to draft an email and all. Because email, whatever you're writing in your email, it is like it shows what is your understanding or your thought process. So focus on your uh, email etiquettes. Then, if I'm talking about skills, then you should have some knowledge about Excel. Excel is something which is very basic because let's say there are few things which comes into Excel format as well. A data, let's say a data or any file. So you should be able to tackle the Excel form as well. Then you should have some basic knowledge regarding PPTs, how to make a PPT, how to showcase your work in graphical format or something. So it depends on what level you are. So if you are growing, let's say you're about team lead and manager level, so then you should be able to present, like you should have PPT presentation skills as well. Uh, so if you're starting a career, it always goes into two part later after a certain duration of years. So it will be like a people administrator, or it can be a consultant role where you are an individual contributor. You're actually working for your organization. And if I'm talking about people administrator, the role can be a team lead or a team coach. You can be an assistant manager or a manager. Even you can be a VP. So you will be handling team. Though you are a doctor or though you are a healthcare professional, but still you should have those skills. So just each and every person do has a different type of personality. So if you are an introvert or an extrovert, so just focus on what is your strength and accordingly decide on what path you need to choose after you are into this industry. So there are few folks who are more into people administration. So they like to handle a team. The team size can be like 5 people or it can be 50, 100 people. So you should make sure like you can handle this thing. And if you're an individual contributor, or let's say you're into product or project management, then you will be given a task for a certain duration and you have to work on it accordingly. So there are multiple things, but always focus on what you want and then decide accordingly.
Surely, this communication skill is definitely a must-to-have skill in all the industries, irrespective of where you are working. Yeah. So, moving on to next part, I want to ask you, like I have seen many people who are working in US healthcare industry. They are working for part time, like they are managing their clinic, and in some time they are doing this kind of work, or maybe they are doing some kind of task which they can handle from their home, comfort of their home also. So definitely both or this situation are very lucrative for any individual, and particularly for young medical graduates. So what is the current trend and current scenario when we look at the work from home opportunities or maybe part-time work opportunities? What is the current scenario in the US healthcare industry?
So after COVID, like this work from home opportunities has increased a lot. But it depends on what process you are into. So if you are having a patient-centric data into your process, let's say the patient name or the patient details are showcased into your data, then it is very difficult to get and work from home. Because in US healthcare, we have certain, what we can say is PHI and HIPAA. So this,
Privacy priority.
yes, yes. Uh, patients' data privacy is the main intention of, let's say, the laws are very strict in US. So whenever US healthcare industry is outsourcing any data, so they will make sure that this PHI and HIPAA related, uh, what I can say is, it is followed mainly. and they will have a
Compliance,
contract also. Yeah.
data privacy compliance.
Yes, yes. So PHI means protected health information. So you can't disclose anything related to any patient. It is very private. And if I say HIPAA, it is more of Health Insurance Portability and Accountability Act. So it is there since 1996. So the laws are very strict, and if you are not following it, or if you are uh, if you're not following it, then the repercussions are very severe, and you can be sued also. So the company which is getting that outsourced data will make sure that if you are into this particular patient related data and all, you won't be given any work from home. Uh, so there are few processes where you have to be in office, like for the Monday to Friday you are into office, so you can't skip that. But there are few processes where the patient related data is not showcased as such. It is all related to the main disease part or the history part of the patient. In that scenario, yes, you can get an work from home opportunity. Many organization has started following hybrid model for this US healthcare based industries. There are few companies which do have 100% work from home as well. So this is like a win-win situation both for the employee and as well as for the company as well, because the company will save on something. They will save on electricity, or let's say their Wi-Fi and all. So it is a win-win situation for both. But yeah, it is always open. It depends on what process you're choosing upon. But it can be an hybrid also. It can be work from home also, or it can be work from office 100%.
Thank you, Swapnil, for clarifying that. So now let's talk about the most critical and most exciting question. So how much a candidate can expect as a fresher, and maybe what could be the upper end for some certain experienced kind of candidates, where like how much that income can go up to, and are there any different kind of sub trends within this industry which is more lucrative or which is not much attractive? Can you talk about that?
Okay, so the main question. So, if I will say regarding the compensation part, so it can go from base. So you can start from. So I'm talking annual packages. So it can start from 2.5 lakh or something, as low as that, and it can go beyond 30, 40, 50 lakh per annum. Or there are few folks who are earning more than that, 80 lakh, 1 CR also. It depends on what domain you are from, what certifications you are having. So in the initial go, you won't be getting that much, but the highest amount which I talked about, it is all about your experience into that particular industry, and then you will get that much. So it may vary, but the scope is very huge. Let's say if you're joined on a lower package, but you had done some certification simultaneously, and you had switched your job into some other industry where they had considered your prior experience and your certifications, then the hike can go above 100%, or it can go beyond 200% as well. So I had seen people getting twice or thrice of their current annual packages. So yes, you can be benefited, but it is all upon you, like how you are showcasing yourself as a candidate, and what skills you have. And the competition is very high now currently. Earlier it was not that high, but most of the people are aware regarding this industry now. So, if a company is getting two candidates at one candidate's cost, so they will always prefer that those two candidates only. So it depends, but yes, I will say that you will be benefited a lot. And just make sure that you are doing few certifications simultaneously once you join this industry, because upgrading or upskilling yourself will always help you also. And even internally also, you can get few other positions or get promoted accordingly as per your skills. There are few folks who are into Lean Six Sigma certifications, where it is all related to quality. So whenever an industry is focusing on quality, so they will always try to achieve maximum quality. So if a candidate is having a Lean Six Sigma certification, then it is beneficial for the organization itself. So to achieve a better quality and to impress those clients with less number of errors and all, so that once the contract of that particular client is finished, then it can be renewed easily. Then we have few folks who are into PMP certifications, project management. So if you're doing a certification and if you're getting that role, then it is also beneficial for the company itself, and you will be given few projects where you will be handling it. You can get an onshore opportunity also. So many things. But yes, the compensation is very high compared to the other industries, and you will be benefited.
Okay. But definitely this sounds very exciting, particularly for healthcare industry, where many medical graduates they are trying to explore non-medical fields, and particularly in US healthcare industry. So, if somebody is interested or keen to work in this US healthcare industry, they are looking for this kind of job. So, what are the places where they should find this job, or maybe find and apply to this kind of jobs in US healthcare industry, where they can approach?
Yes. So there are few industries who have started doing on-campus interviews where they are offering placements. Uh, so like I can name one industry institute, ICAS, who is going to medical colleges and hiring folks who are freshly graduated. Uh, Many more industries. Then basically you should have a good connect. Uh, let's say your senior is into something similar to this or into US healthcare, then that particular person can guide you. Or if there are any vacancies in his company, then that particular person can inform you. Or you should have your CVs or resumes updated regularly into big platforms like Indeed, Naukri. Then you should have an account in LinkedIn. This is the basic thing which you should have, as I had talked earlier. And if you're doing an MBA, then the companies are going to give placements into healthcare industries. So yes, so these are the few things, but just make sure like in your resume or in your CV, you should have those keywords. If you're doing any certifications, you should mention it. Your CV is something which is a reflection of yourself. So of your career, your prior experience, and all. So just make sure your CV should be made in such a way that if anyone is reading it, that person should be impressed. Even they had created such tools where they will only catch those keywords, and your CV will be extracted from those thousands of CVs. So these are the basic things, but this helps.
Thank you, Dr. Swapnil. Thank you for giving your insights on this US healthcare industry. This is definitely valuable. So, for the audience, if you have any questions related to today's discussion, you can definitely ask your questions in the comment section. And even if you are like confused about choosing the different career paths within the US healthcare industry, You can ask your questions and get clarification on the comments. So on this note, if you are still interested into any particular domain within any other industry or other subdomain within healthcare industry, you can ask about it on the comment section, and I'll definitely try to cover it in the next episode. Uh, and I hope you have got some valuable information from today's episode. And I definitely thank Dr. Swapnil for giving his valuable time and his knowledge about the industry. So, if you are not subscribed, please subscribe to this channel and stay connected with me. So, that's all for now. This is Dr. Nitin signing out. Bye bye.